Hey guys, welcome back to the Lovin Dubai show. Today we're joined by Dr. Aydah Awadhi, who is the consultant medical oncologist and chairperson of the Breast Cancer Working Group under the Emirates Oncology Society. She's answering your key questions regarding breast cancers. Thank you so much for joining us. Welcome to the show.
Thank you. It's such an honor actually to be here and to spread the word about breast cancer, which is very important. It's the end of October month, so I think we've done a lot and sort of like to talk about breast cancer awareness, and I think it should carry on throughout the year because it's a very important topic. And thank you so much for having me again.
Of course, thank you for coming in so early. Do tell us how common is breast cancer, especially in this region?
Yeah, so breast cancer is the #1 cause of cancer worldwide, and that's per the WHO statistics in 2020. And again, when we talk about female themselves, it's also the #1 cause of cancer. But when it comes to the UAE, it's not different. So it's again, when we look into all cancer, it is the most commonly diagnosed cancer in both when we look in both genders in general, and then also in female in particular. So that is also according to the statistics from the Ministry of Health Cancer Registry in 2000 that was published in 2019. But when we look into something different between what's happening in the UAE and then in the Western population, for example, in the United States, we know that our breast cancer patients are diagnosed earlier at age. So we are 1 decade before. The median age at diagnosis in the UAE is like in the 50s, whereas it's actually in the 60s. So that's a little bit different than that of the rest of the world.
Wow, that's so interesting. And what is the UAE doing to accelerate the diagnosis? How is this happening?
Yeah, so there has been a lot of initiatives with that. I mean, first of all, there's a lot of awareness campaign that's happening in governmental entities, private entities, even individual. There's a big awareness in the social media. So a lot of we see more and more women seeking medical attention when they have noticed any changes in the breast. But not only that, but they go also for their screening. And we recommend all patients to get the screening at the age of 40, all women at the age of 40, and then every other year from there. So that's also very important. We have cancer centers which is capable of like appropriate diagnosis, providing treatments and all of these things throughout the Emirates of Abu Dhabi and Dubai. So we do have everything available for them in case they have anything abnormalities detected in their breast.
So how advanced is the UAE when it comes to just, innovative treatments for breast cancer?
Yes, absolutely. So I trained in the United States and I came back to the UAE and I did not see any difference, honestly. So we do have all the medications available to us. The minute they get FDA approved, we do get them in the country and it's available to our patients. So that's the diagnostic test. We talk about chemotherapy, we talk about radiation techniques, we talk about surgical techniques. We all do have all of these expertise in the United Arab Emirates, and that's very similar to that of the rest of the world, including the United States, UK, and other countries as well.
So interesting. And in terms of treatment plans, if someone is diagnosed, how important is it to adhere to those treatment plans from the moment they get that diagnosis?
Yeah, so adherence is very important. We talk about, adherence to chemotherapy, adherence to hormonal therapy, which most of, breast cancer patients at one point will need, So this is very important because we have a lot of studies saying that if you did not adhere to your medications, the outcome can be worse. So it's very important. We encourage all the patients. The first thing that we do to ensure adherence is educate the patient. They should understand why they need to be on these medications, how it will help throughout their course of the disease. And then we tell them that, one of the issues that maybe patients do not adhere to medication side effects. So we have to address side effects. There should be a regular follow-up with the oncologist, or, the medical team to ensure adherence, addressing the side effect, because if patients, for example, have that hot flashes from the hormonal therapy, we can manage that. We do. She doesn't have to stop the medication. We can do something about it. Yeah.
Okay, so when it comes to like you said, you have to educate patients and empowering patients. How exactly do you do that to make sure they make the informed decisions like throughout their treatment?
So I personally, and I know a lot of oncologists, they do that when the patient comes to my clinic on the first visit. I make sure I explain everything to her, of course, as much as she wants and she able to absorb. But at the same time, I like to have her family with her because sometimes it's just too difficult for the patient. A lot of things going through her mind, right? So it's like difficult for her. So the family member will grasp some of the information and just tell it back to the patient later on. But I make sure that the patient asks all of her questions. When she gets out of my office, she just know basically the bread and butter of her breast cancer diagnosis and how she should be treated, and I take her throughout this journey. The more they ask questions, I encourage them because the better they can make a decision, because we do have many treatment options, and sometimes not only one option is the right option. Sometimes we have two options, so she has also to make the right decision for herself, guided by us.
She's empowered to make those decisions.
Absolutely, absolutely.
It's so interesting that as you answered those questions, I was thinking of, things I've heard about breast cancer in the past that may or may not be true, because there's so much maybe miseducation around it. So we wanted to bring a game to you guys, and also if you have any questions to drop in here, great as well. We're going to call it myth versus fact. So we're going to say something. If it's a myth, it gets the buzzer. Okay. And if it's a fact, you can just explain to us the fact behind the statement. So let's kick this off. We're doing myth versus fact, the breast cancer edition. First off, early stage breast cancer rarely recurs.
That's actually, I would say, more like a fact. So the earlier we detect the breast cancer, the less likely that it's going to recur in the future, because basically if we picked up the cancer at very early stages, the cure rate can be as high as 95 to 98%.
Wow.
So that's exactly why we need early detection for breast cancer and spread the word on screening.
Before we jump into our next myth versus fact, I just have a question on that. You said the average age in the UAE is in the 40s.
In the 50s.
In the 50s. So how can it be more in young patients? What does early detection look like?
So at 40 years of age, this is the standard guideline that we are adopting here in the United Arab Emirates, although we are seeing younger patients. So those patients, we like to educate them to be aware about their breast, any changes of the breast, and then immediately seek medical attention. And once they reach the age of 40, then they have to start the screening. Now, there are high-risk patients, those with very strong family history, lifetime risk of 20% of above, or those with BRCA mutation, which is a germline mutation that can be hereditary, that can spread throughout generations in the family. So those patients, we like them to be screened earlier, but not only with mammogram, also with MRI as well. But that's a decision that the woman will have to make with her doctor in the clinic.
Okay, that's so interesting. I had no idea, and hence the regular checkups. Okay, so next one, treatment adherence is not necessary for early stage of breast cancer.
That's a big myth.
Big myth?
That's yeah. So yeah, we talked about adherence and how important the adherence is and how it will lead to better outcome and higher chances for cure, of course.
Okay, makes sense.
Yes.
Next up, breast cancer is always fatal.
That's a big myth. The minute the patient comes to my clinic, I tell her breast cancer is not a death sentence. No, the treatment, we are the first step is early detection, and we know that equals to better chances of cure. And we have improved tremendously in terms of treatment options, and a lot of patients, I have patients in my clinic survive. We call them survivors. And in the minute you are diagnosed, we call you a survivor. We call the patient survivor. But even I have patients 10 years, they continue just to follow up regularly with me. I have 15 years, and I'm definitely gonna see, patients this is something just behind them. They finish their treatment and they are just back to their normal life. So the cure rate is high when we detect early, and it's breast cancer. Most of the cases is not fatal.
So interesting. So once survivors get the all clear, then you would recommend maybe coming back just for checks every now and then,
Yes.
but they officially have the all clear.
Yes, absolutely. I mean, being vigilant about your health in general is very important. Just routine checkups and these things. Yeah.
Okay, so the next one, lumps are the only signs of breast cancer.
Yes, that's a misconception. Actually, breast cancer can be just thickening of the skin and the breast. It could be redness. You know, redness can be also a sign of inflammatory breast cancer, which does not necessarily come with lumps. So that's very important. And a lot of breast cancer, actually, they don't feel anything. And we detect it through screening mammogram. So a lump is not the only sign of breast cancer.
So interesting. So if lumps are not the only sign for young patients, what age do you recommend? Is it at the 40 age that people should be getting mammograms and MRIs?
Yes.
Or is there ways for earlier, younger patients
so
to diagnose?
MRI is not the standard to screen patient with. It's a mammogram. It's a mammogram. So starting at the age of 40 and every other year. Okay, but higher risk patient, as I mentioned, those like with strong family history, you know, we may do MRI plus mammogram for them, and that is per the physician decision based on the lifetime risk of the patient. But in general, most of us average risk women at 40 years of age and every other year. Mammogram.
Okay, yes. So the next one, all breast cancer, you know, like is treated pretty much the same way.
I anticipated this question because I get asked a lot by my patient, like, why is she getting radiation? I'm not getting radiation. Why she's getting chemo? I'm not getting chemo, you know, and the other way around. So no, we have different types of breast cancer. Each breast cancer is treated absolutely differently. So the treatment options usually based on the age of the patient, the menopausal status of the patient, the stage of the tumor, and then the biologic characteristics of the tumor. So it's more complicated than this. And we usually, in cancer centers, what we do is that all newly diagnosed patients, we present them in the multidisciplinary team where the medical oncologists there, the surgeons, the radiation, to tailor the best approach for the patient.
So interesting.
Yes.
And very finally, early stage breast cancer does not require any treatment.
Late breast cancer, okay, that's another myth. Because late breast cancer, meaning stage 4 breast cancer, when the cancer unfortunately has spread to the rest of the body, like the liver, lung, and brain. Fortunately, it's not the most stage that we see in the clinic, but unfortunately we do see it. We know when it's stage 4, it's an incurable stage, meaning that there is no medication that will take it away, and the patient will have to stay on medication for lifelong. Having said that, we haven't also gotten better in terms of treatment. We do have very effective treatment, not necessarily chemotherapy. We have biologic agent, hormonal therapy, you know, the smart therapy, immunotherapy as well. And all of these, you know, are very important. And we see more patients staying on these medications for a long time, and in some cases also in remission. But unfortunately, they have to stay on medication for a long time, but at the same time with good quality of life, because we have gotten better in terms of the treatment options that we can offer the patient.
Absolutely. And for anyone watching the show, seeing as it's Pinktober, have you any advice for women of any age who are watching the show right now in terms of what they should be aware when it comes to breast cancer?
Yes, I would. I don't want to scare all women. I mean, most of the the changes that happens in the breast is benign actually. But if there is 1% chance that it can be cancer, that's why we advise all the patients to seek medical attention to a doctor which is specialized in this, who can give her appropriate diagnostic test and also treatment options. So any changes in the breast, like for example, lump, new lump, redness in the skin, thickening in the changes in the nipple, for example, heaviness under the arm, or any changes, seek medical attention. That's very important. And start your screening mammogram at the age of 40 and every other year.
Every other year. What you said about early stage detection is so interesting. I hope that resonates with a lot of people. I think it will.
Early detection means better chances for cure. So that's very important, yes.
Very important. Thank you so much for your time this morning, Dr. Aydah Awadhi. We really appreciate your time, and that is all we have time for on the show this morning. We're back with you tomorrow morning, same time, same place. Goodbye from me.
Goodbye from me.
Goodbye from me.